I'm Dr. Meredith Warner. I'm an orthopedic surgeon in Baton Rouge, Louisiana, and I have an orthopedic surgery and wellness practice where we're proud to offer the latest and greatest and most tried and true methods of treatment for different problems that hopefully are mostly non-surgical, because I'm a big believer in the body healing itself and empowering people to take care of themselves. So what can you do to prevent arthritis? Remember I told you about the modifiable risk factors. We don't want to modify aging, right? Because none of us want to stop aging. If you stop aging, that's not a good thing. What you want to do is age well. So exercise, and this kind of scares some people and they get turned off and they just want to turn the webinar off and go away. I'm not talking about going to CrossFit. I'm not talking about regimen fitness or F45 or all of these fancy aggressive or Orange Theory. You don't have to do all that. There's a lot of literature on exercise, a ton of data. I just read a really great book from a Harvard professor on exercise. I think the title was Exercised. Really, all you need to do to age well and keep your joints healthy and your muscles and ligaments is walk, believe it or not. You walk a few times a week, and then you lift weights maybe twice a week for your bone health and to prevent what's called sarcopenia, which is the loss of muscle as you age. That's really all you have to do. Now, if you want to add yoga for flexibility and balance strength and core strength, more power to you. That's awesome. But at the end of the day, if you want to age well, the bare minimum and really almost all you have to do is walk a few times a week and maybe lift some weights a couple times a week. So don't get turned off by exercise. It is totally doable. Protect the joints. So that's where the yoga and the balance strength comes into play and flexibility. If you have a super tight hamstring, your quadricep, which is the muscle that extends your leg, maybe I better show you this way. The quadriceps here, and that's what extends your leg. If you're really tight back here on your hamstring, well, guess what? This quad has to work, and it puts a ton of force between your kneecap and the femur, and that causes more arthritis. So flexibility where you have tight muscles is key. And so, for instance, my physical therapist can offer stretching programs for people. We can put people in the infrared spa, get you warmed up, stretch you for 5 or 10 minutes, and you're on your way. So there's a lot of ways to address these problems, but joint protection is key. Wear decent shoes when you're working out, and that's going to depend, of course, on any foot pathology you might have. But there's certain shoes that are highly shock absorbent for walking. And then stretching, as we said, and then core strength, not just in the spine, but foot core strength matters, and hip core strength is huge for helping you prevent the symptoms of arthritis. And then what I tell people to do is have just a baseline level of anti-inflammation in your life. You know you're chronically inflamed. I am. If you live in the United States of America, especially if you live in Louisiana, you are surrounded by pollution and toxins. Your diet is not good. You're not eating enough fruits and vegetables, and you have too much oxidative stress and chronic inflammation. So I try to take as many different types of antioxidants as I can to combat the different types of oxidative stress that occur at a cellular level. And I give myself a baseline of this. And then hopefully you don't need as much of the other drugs that we talked about before. I'm not saying you might not ever need them. I prescribe these things every day, but hopefully you'll need fewer and fewer, and therefore will have fewer and fewer side effects, and you'll just start to feel better.